Good morning, everyone. I would like to thank you for joining this session. My name is Catherine Addison, and this session will be discussing addressing equity in health through the criminal justice perspective. We have three presenters today. We're going to present the presenters and then save the questions for the end. So please utilize the chat section so that we can ensure that questions are available to our presenters. First, I would like to introduce Abigail Baum. She is a doctoral student at the Department of Health Policy and Management at St. John's Hospital in Bloomberg School of Public Health. Her dissertation research focuses on the level of participatory governance in the recent police reform efforts, and she conducts research on Baltimore's residents' perception of police with the Center for Gun Policy and Research. Thank you, Abigail. I'll turn it over to you.
Great, thank you. So I'm going to share my screen now, and hopefully this all works. Go in presenter mode. Don't know if that worked. Okay, can you see the just the presenter, or do you see notes?
Just the present.
Okay, perfect. Well, thank you, Catherine, and hello, everyone. Welcome to the Criminal Justice Panel. As Catherine mentioned, I'm Abigail, and I'm currently a doctoral student at the Johns Hopkins School of Public Health. So I'm going to start by examining the story that these two photos tell. In the left, we have Black Lives Matter protesters shielding their eyes after the police cleared the street near the White House with tear gas. And on the right, we have a police officer tending to a pro-Trump rioter after he was injured by tear gas in last week's insurgence of the Capitol. These images lead us to wonder, who is the public for which public safety exists to serve and protect? To answer that question, we have to look at the origin of American police. In both the northern and southern regions, there were bodies formed to address the social disorder caused by increased heterogeneity. In the north, these transitioned into formal police agencies in the mid-19th century, following the model established in England. Conversely, in the south, starting in 1704, there were slave patrols created in the Carolina colonies to chase down, apprehend, and return to their owners runaway slaves, and to provide a form of organized terror to deter slave revolts. Following the abolition of slavery, these entities morphed into federal military, state militia, and the Ku Klux Klan. By the end of the 19th century, they transitioned into agencies or entities that resembled the formalized municipal police departments in northern cities. These police organizations shared a set of characteristics that hold true to police departments of today. They were publicly funded and bureaucratic, and that they were located in the executive rather than the judicial branch. They were full-time employees as opposed to volunteers or case-for-case fee retainers, which in fact actualized the concept of police preventing crime rather than just responding to it. And the departments had permanent and fixed rules and procedures. Additionally, the police had limited police authority in that the powers were determined by law, and there was local control in that the local governments bear the responsibility for providing public service, police service, and they are fragmented, meaning that several agencies within a defined area share the responsibility for providing police services. The decisions to carry firearms and the use of force when interacting with citizens were two additional attributes that differentiated and have come to define American police. The history of police reform reveals the trade-offs that have occurred as police professionalized and focused on responding to crime rather than preventing it. The scope of police duties has fluctuated over time based on the ideological lens through which law enforcement has been viewed. For example, in the early 20th century, there was a shift away from providing social welfare to citizens to focusing only on illegal crimes, which has led American police to be identified solely as reactive service providers rather than public health preventionists. I'm going to quickly highlight reform efforts because there's a lot of them, but the first is progressivism, which led to training of officers and the adoption of technology to more effectively respond to crimes of violence at the cost of the allocation of resources to responding to citizens' broad welfare. In the 1960s, police reform followed the civil rights legal strategy of leveraging judicial interpretation of the Constitution and focused solely on professionalism and police handling of serious crimes, and not at all on the issues pertaining to the needs of citizens in social disorder, nor the police's own role in perpetuating that disorder. In the 1960s, when there are current rulings more favorable to unionizing of public employees, the unionizing of the police provided rank and file officers protections and organizing ability. Amidst a national program of mass arrest, there was the first Great Awakening when 50 large cities reduced by half the annual number of people killed by police, mostly through bans on shooting nonviolent fleeing suspects. Whereas the reform in 1981 focused on addressing the idea of the problem officer by rolling out early intervention programs, the federal reform in 1994 started to acknowledge problems with the entire police organization. And finally, in the second Great Awakening, with social media and phone cameras and documentation, the public, media, and some politicians called for solutions that address the overt use of force by law enforcement disproportionately on members of non-white communities. Police reform is not a new concept. However, the present shift toward defund the police and abolition stems from frustration that past reform efforts have not successfully changed the current policing crisis. In the first 10 months of 2020, 39 states and at least 24 municipalities introduced some form of police reform legislation. The type of public safety reform falls into three categories: abolition, defunding or restructuring, and reform. And there's no universal police reform legislation. I'm going to focus on Maryland as a case study to put this all into play. And we can see the multiple levels of law enforcement. In addition to the municipal, county, and state police department, in 2017, following the death of Freddie Gray and an investigation into police misconduct, the US Department of Justice, a federal level, entered into a consent decree with the city of Baltimore and the Baltimore Police Department. Maryland was the first state to establish the Law Enforcement Officers Bill of Rights, which distinguishes police officers from other citizens and provides them with privileges not afforded to civilians. Since the death of George Floyd, several municipalities and counties have taken up a spectrum of reform. We have Baltimore County implementing a series of reform that focuses on police conduct and behavior. We have example in Baltimore City of defunding, and we have in Anne Arundel County, which houses Annapolis, an example of changes in leadership. And then in Montgomery County and Prince George's County, we also have examples of task force to decide what to do. At the state level, there's a package of 15 bills being considered by the General Assembly that is back in session this week. Just of note, and for time's sake, I'm going to focus on a few of those. The first one is the use of force standards, which will specify factors for a court to consider, in addition to what the plaintiff alleges, the improper use of physical or deadly force by a police officer, and to standardize that. The second one will create a database that will be a compilation of and make available records that will talk about the credibility of a law enforcement officer as a witness, and also reveal the formal complaints filed against officers. And then the fourth bill on this list establishes a duty for police officers to intervene, requiring a police officer to make a reasonable attempt to stop or prevent use of excessive force if the police officer knows or is reasonably should know that another officer is using or intends to use excessive force. And then the last bill is a proposed repeal of the Law Enforcement Officers' Bill of Rights. To conclude, we have to reflect on the likely effect of the swell of police reform that has emerged over the last 7 months. Will the various forms of reform bring about the desired change? Is the incremental approach to change enough, or does the problem lie in the system itself that needs to be abolished? The role and identity of law enforcement has been challenged by current demands on police to take responsibility for and to engage more fully in community social welfare, duties that fall outside the reactive crime-fighting role. Because of policing's historic origins, policymakers and community activists have begun to look to newly available service providers trained in different skills and approaches and free of that historic and racial and cultural relationship to use of force to perform these community welfare duties. But the question remains, are the police able to be reformed in a way to meet the needs of all members of the community equitably? Thank you. That is the end of my part of the presentation, so I'm going to stop sharing right now.
Thank you, Abigail. That was definitely very informative, especially about the different laws that are currently being proposed in the Senate judiciary proceedings. Hopefully we can see more with the new administration coming in. The next person I would like to introduce to you is David Bever. He is the Executive Director of Delaware Center for Justice. As a nonprofit leader, he has been in the business for over a decade, working with agencies and systems to help individuals struggling with overwhelming life challenges. Thank you and welcome, David.
Thank you very much. I'm going to try to share screen here. And just to give a little bit more background on myself, I'm a social worker by trade, and I started my career as a county level probation officer with domestic violence cases, and then eventually became a supervisor of that unit at probation. So I sort of started in the criminal justice sphere and then moved over to crime victim services and have been in nonprofit leadership and fundraising ever since. So that's where I'm coming from. So the Delaware Center for Justice is 100 years old. We just turned 100. And not surprisingly, we've evolved quite a bit during that time. Our name changes reflect that evolution in terms of the scope of our work, our growth as an organization, and how we've balanced policy and advocacy work with direct service. On June 10th, 1920, several hundred Delawareans met to establish the Prisoners' Aid Society of Delaware. They set an agenda to create a detention home for untried prisoners, a separate women's prison, a satisfactory probation and parole system, and to abolish Delaware's use of the whipping post as a lawful punishment. For some perspective, for those people 100 years ago, the Civil War and slavery were still living memories for some of them, and lynching and the first iteration of Jim Crow were contemporary realities for them. So that's the environment DCJ was forged in. And just one last note on the whipping post. It was still in use in Delaware until 1972, and it was only dismantled in the last year. So in 1965, the Prisoners' Aid Society changed its name to the Correctional Council of Delaware and added reentry services for the first time. It's noteworthy that today in 2021, reentry is still our biggest program and represents half our budget. In keeping with our original mission, we advocated to renovate our juvenile detention centers in the 1970s and added services for women prisoners and AIDS education for incarcerated people in the 1980s. In the mid-1990s, we again changed our name for the final time from the Delaware Council on Crime and Justice to the Delaware Center for Justice and added programming for victims of crime. Our most recent expansion is that we have doubled the size of the capacity of our reentry programs to include transitional services right at the prison gate. I'm not going to break down each of our programs in the interest of time, but it's sufficient to say that the Delaware Center for Justice works with young people and adults across the criminal justice system, from pre-adjudication and detention of youth to incarceration and reentry of adults, also including services for victims of crime. Beyond our scope of services, what makes DCJ unique is that we also work in Delaware's policy and legislative space. Our Stand Up for What's Right and Just, or SURGE program, is staffed by a full-time policy coordinator who's primarily responsible for this work. This year, we adopted a new mission and vision to launch our second century. Again, I'm not going to break this down, but just to give some perspective, we consider justice to be an aspirational thing. I've said criminal justice system during this presentation, but we typically refer to that system as the legal system because we see justice as something that is yet to be achieved. Our systems are not simply in need of a little repair, and a permanent solution is not just around the corner. If this were true, systems would be easier to change and there wouldn't be so much pushback when we tried. We also believe that justice equals access to opportunity across the lifespan, and that injustice is the systemic denial of that opportunity. So some statistics here from the Center for American Progress. People of color make up more than 60% of the prison population, but only represent 39.9% of the US population, and African Americans specifically represent 13% of the US population, but comprise 40% of those incarcerated. So why am I talking about incarceration rates to illustrate issues with policing? Because who goes to jail is a reflection of which communities are policed, and these numbers suggest what we already know. Communities of color are over-policed, resulting in people of color, particularly Black men, being overrepresented in the legal system and in our prisons. 1 in 3 African American males born in 2001 will go to prison at some point during their lifetime. That number is 1 in 6 for Latino males. African Americans are 2.5 times more likely to be arrested than their white counterparts. And in interactions with law enforcement officers, young Black males are 21 times more likely to be shot by a law enforcement officer than their white counterpart. Again, that is from the Center for American Progress. Also, as you can see here from this chart from the Prison Policy Initiative, police are twice as likely to use force against people of color. And that leads to an understandable lack of confidence in police on the part of people of color. Latinx, illustrated here, and especially African Americans, don't believe they will receive equal treatment from the police, and that has serious implications. Communities of color are less likely to reach out to law enforcement in cases of violent crime or child abuse or domestic violence because they anticipate unfair or excessive treatment. As it is, the system also disadvantages people living in poverty. Samantha, whose name has changed for purposes of this presentation, is a mother of 2 who lives in Delaware, gets a speeding ticket when she's rushing home from work to pick up her 2 kids. Either due to stress, other priorities taking precedent, or just plain old not being able to pay the ticket, she doesn't pay it before it's due. So a year later, as she's going through the interview process for a new job, she's shocked when a pre-employment background check reveals her license is suspended and there's a warrant for her arrest for that same unpaid speeding ticket. She goes right to the courthouse to set up a monthly payment plan, only to learn that that debt has more than doubled because of processing and fees. Despite every effort to stay current, she misses a couple of payments, and a routine traffic stop a year later results in a trip to jail and her car being impounded. For just a few days in jail, she loses her job, which causes her to lose her apartment, and nearly loses her children, all over traffic fines and fees. So an unpaid ticket leads to potentially losing your job, your health insurance, possible involvement in the child welfare system, and a few hours spent, at least in 2021, trapped in a COVID-19 hotspot, which is how I will describe our jails and prisons at the moment. Samantha is just one of many people who must make the heartbreaking choice between feeding her family and paying her court debt. She's the reason we don't just provide direct services, we have a policy agenda too. In terms of pretrial reform, we do not believe that people should be locked up and face all of the consequences we've discussed for $100 or so that they cannot afford. Brian Stevenson of the Equal Justice Initiative has a quote regarding this. I'm going to get it wrong, but the gist of it is it's better to be rich and guilty than poor and innocent in our system. Because, so take into consideration, if you don't have the ability to pay your bail and very likely don't have a fancy attorney, you are likely to take a plea agreement and all the consequences of a criminal record for something you may not have done just to get out of jail. In terms of fines and fees in Delaware, as Samantha's story illustrates, your driver's license can be taken for unpaid fines and fees, and it's counterintuitive to assume that someone who can't drive to work is going to ever eventually be able to pay their fines and fees. DCJ is also working towards policing reform in Delaware. We are hoping to replace the Law Enforcement Officers' Bill of Rights with something that takes into account use of force and building in civilian accountability measures, because we need trust between communities of color and police. To that end, right now, Delaware has a law enforcement accountability task force that's operating, and one of the positions DCJ is taking is to remind that conversation as it's ongoing that this is not about framing a compromise. This task force was called to action because George Floyd was murdered, and it's there to address the issues that the community has brought forth, not necessarily to create a compromise with law enforcement. Another policy priority of ours is school policing reform. We call our school police officers school resource officers in Delaware. They were created to deal with school shootings. That has not been the outcome. Instead, it's now a primary driver of the school to prison pipeline that puts kids, particularly Black and brown kids, into the criminal justice system instead of addressing problems with desperately needed social services. In Delaware, we have learned, unfortunately, but again, this is why it's so important that we do direct service work and do policy work so they can inform each other, that kids who are being charged, even before they're adjudicated, because schools are being provided lists of who has been charged in the community, some of those kids are being moved into alternative schools just as a result of getting charges and not because they've been adjudicated. Another policy priority for us is wrongful convictions. We definitely want folks to be compensated if they've been wrongfully convicted and incarcerated. And data transparency at every level will help us do good policy work. That's my portion of the presentation, and there's my contact information. Thank you for listening.
Thank you, David. That was very informative with the beginning history lesson around the whipping post. And it's just really interesting how, we still are struggling with these symbols that we have in our communities as we look at, changes. So thank you so much for sharing that. And I also like your approach regarding justice is aspirational and is yet to be achieved. And that's why we're in the work that we do. Thank you again. The next presenter I would like to present is actually my boss, Laurie Corbin. She is the Managing Director for Community Engagement at Public Health Management Corporation. She has over 30 years experience working with programs serving high-risk population. This includes the Forensic Service Program, which represents a continuum of programs that focus on diversion and early release from incarceration and justice-involved individuals. So at this time, please hear Laurie Corbin. Thank you.
Thanks, Catherine, for that introduction. And can everybody see my PowerPoint just before I start? Okay, cool. So good morning, everyone. I'm glad you all decided to join in this session and discussion, and I've already learned a lot from my colleagues, Abigail and Dave. I'm going to pivot a little bit different to a little slightly different focus in my presentation and really talk about working with justice-involved individuals to address their behavioral and physical healthcare needs. And this really has come out of my work for the last 10 years with PHMC in our forensic services area. So again, PHMC is the Public Health Institute for both Pennsylvania and Delaware and the State Health Association for Pennsylvania. And our vision is that we envision a healthy community for all. Talked about we're already a nonprofit institute that really helps to create and sustain healthier communities. And then our approach is really around using best practices and evidence-based guidelines to improve community health through direct service, partnership, innovation, technical assistance, and a prepared workforce. PHMC has a diversity of programs that really impact high risk and most vulnerable populations, and many of which have been unfortunately touched by the legal system. And Dave really talked about sort of the change in language from legal to justice. I actually back and forth with it. And I think that's one of the things that we as a culture and a society are really looking at, sort of how we really look to better address, and even just how we are even how are we referring to people who are involved in the legal system without shaming or blaming or demeaning who they are. So again, Dave gave a little bit of background about those who get incarcerated. I'm going to talk about it a little bit from the angle in regards to behavioral and physical health care needs. There are about 2 million people a year who have serious mental illness that are arrested each year. And then according to the Bureau of Justice Statistics, there are about 25% of those individuals meets the threshold for serious psychological distress. And sometimes you'll hear the term serious mental illness SMI population. And there's some sources that document this is up to 50% of the individuals who are incarcerated. And of those, that 25% who've been identified as having a serious psychological problem, at least half have been seen by a mental health professional that they do have a mental illness. And one of the things I'm going to say is that in Philadelphia, it's a county as well as a city. The Philadelphia Department of Prisons runs the largest mental health hospital within the county of Philadelphia. What does that say about us as a society, that in order to be really inpatient mental health treatment, you have to be arrested and hospitalized while incarcerated? Think about that. There's something that's not quite right about that. 45% of jail inmates and about 53% of prisoners have a substance use disorder. And again, for those who may not understand, jails are usually at the county level, prisons are really at the state level. So that's the differentiation. And then trauma is pervasive for justice-involved individuals. And we know trauma is pervasive in our society as a whole. In particular, people who have been involved with the legal system really present as really being impacted by a trauma. That could be trauma from physical abuse, sexual abuse, psychological abuse, and most notably, violence in the community. Our communities are literally under fire, and I can say definitely in the city of Philadelphia, where we had the second highest level of murders in 2020 in the city since the early 90s. So clearly people who are coming into prison are impacted by trauma. If we talk about health disparities and those justice-involved individuals, again, as Dave talked about, who's represented in the criminal justice system, it's minorities, which again is reflected, which is again, it's a representation of that particular first statement. Really means health disparities among minority populations are really noted within our general population. And I think COVID-19 really has brought that to the forefront. We really see where Black and brown people are really significantly impacted in a negative way from COVID-19. I can actually say from the experience of working with both my team as well as with our participants, those who have been primarily impacted by being COVID positive are minority individuals. Again, 95% of those individuals who return to the community, they're going to come back home. So I think people think about those people over there, those people that are in prison, we don't have to worry about them. But those people are our friends, our neighbors, our family members. This is stigma that we have not gotten away from, that is those people over there. No, it's our brother, it's our sister. And folks are coming back into the community, and their health problems, which they had when they were incarcerated, still are exacerbated when they come out of prison. In addition, again, to be reflective about issues that happen or impact brown and Black communities, is that incarcerated individuals are disproportionately have higher rates of Hep C and HIV, as well as chronic health conditions, including hypertension, asthma, arthritis, cervical cancer, heart disease. As we know, access to care, racism impacting healthcare, lack of trust in the healthcare system, and other social determinants of health impact overall well-being. We know from the information and the data that we have that, again, communities of color, which are overrepresented in the criminal justice system, are more significantly impacted by these same things. So again, Those who get arrested are no different. They are just reflecting the disparities in the Black and brown communities in our larger society. Formerly incarcerated people are 10 times more likely to be homeless, which we know from our experience, and Catherine's aware of this, a large number of our individuals, when they are being released from the county jail, really don't have anywhere to go. And if it were not for a network of recovery housing, there are individuals who remain in custody because there is no place for them to reside in. Homelessness is a big issue that could be another whole topic as related to public health. But again, it's just when, it's just the sort of the building on, or the towering of issues and concerns that are impacting those related to health, social determinants of health for the justice population are just outstanding when we're talking about people who get incarcerated. And then we have special populations, the needs of women, the LGBTQ community, transgender and non-English speaking individuals who have not special needs, but have additional needs, additional support. What they need are different when they're outside of the walls of the prison or the jail, definitely different when you're incarcerated. And then COVID-19 just has really had a significant impact on minority communities, again, including those who are justice involved. I'm going to talk a little bit about PHMC's forensic services programs, which we really try to integrate physical and behavioral health care for the individuals that we're actually, I would say, given the privilege to help support while they work their way through the legal system. So our work with justice involved individuals includes what we do. We provide a continuum of assessment and case management services, which support those individuals who have interfaced with the legal system. Why? The goal is really to enhance community safety by reducing criminal recidivism through the provision of behavioral health, physical health treatment, and other related services for individuals as an alternative to incarceration. And I'm going to stop there for a minute. I will say the population of individuals we work with are nonviolent felony offenders. These are not violent criminals that are coming in to our program. But for the most part, historically, these are folks who have been drug dealing and many times most times drug using, but many times drug dealing. Drug dealing, why? In order to support their households. They're not just supporting themselves, but they're supporting extended family members, which really talks about the economic impact on communities around not having jobs, workforce development, which is also, again, intertwined with when we're talking about working with the justice-related population. And then, so it's not all about the safety of the community. I think sometimes it's also about the perceived safety within the community. And then collaboration, how do we do it? Collaboration and integration with justice and health partners, really key to our work. This is actually my favorite slide. Whenever I do a presentation, I think it just speaks to, it takes a village. Well, it really takes all of us, all of these different entities, and then there are about 16 entities here, working together in real time in order to support individuals who have legal involvement, really from time that somebody potentially is arrested through them either coming out of jail if they're incarcerated, or for being out on bail when they're getting connected with us around services, and then our linkages with them to both behavioral health, social services, and physical health services in the community. The one thing I have to say about this group, we do real-time communication and collaboration. It is amazing. When things are working really well, it is amazing how quickly we can get someone connected to services. And when our communication is really bad, it's amazing how long it takes to get somebody connected to services. Okay, what happened here? Why do I have, sorry, I wasn't expecting that. Okay, forensic services programs. Again, it's a model of service delivery, includes close collaboration, as I've talked about before, so I'm not gonna repeat myself there. We talked about doing clinical assessments and case management services, and our programs include diversion, early parole, and release, and specialized drug treatment courts. This is, we're in around 8 or 9, well, I would say very distinct programs. All of them have acronyms. The original program, which is the Forensic Intensive Recovery Program, has been around since 1993, which, believe it or not, which was developed to really address prison overcrowding and really looking at who was being incarcerated. If anybody remembers or knows their history, In the late 80s, early 1990s, this was at the peak of the crack epidemic. And so many Black and brown people were being incarcerated due to, drug use and drug dealing as related to the crack epidemic. And so these programs, the Forensic Services Initiative, and in our community, it's referred to as FIR, F-I-R. This program was really developed from leadership in the city, and actually because of legal cases. There were consent decrees that required the prison decrease their prison population. So again, a series of our programs and services that are available. So again, a FIR program, really, again, collaboration with our legal partners. We complete, my team of behavioral health assessors, complete evaluations with individuals behind the walls of the Philadelphia Department of Prisons. So we go behind the walls, we interview people, we get their behavioral health history as well as social service history to determine whether or not, Laurie, if she's been incarcerated, does she have a behavioral health concern that she needs to get connected to services upon release from prison. We do not determine who comes into the program. Actually, working closely with the Defenders Association, they identify participants for the program, and they work with both private attorneys as well as those that they represent, in the legal aspect. And then, one of the things about our program, if we look around sort of the outcome on the other side, once somebody's released from prison and they get connected with our case management services, those individuals who complete 6 months of substance use and the behavioral health treatment from FIR are 66% less likely to be convicted of a new crime. So again, it's really getting people the services and the supports that they need in order to address their behavioral health and physical health concerns. In light of, I'm going to talk a little bit about sort of how our services have happened historically, and then how we've had to pivot in light of COVID-19, because I think that's really important, the context of when we're working right now. Our traditional service provision, in-person behavioral health assessment behind the walls, face-to-face contact by our case management teams within treatment facilities, probation and parole, recovery houses. We do warm handoffs, linkages to treatment, and that's really important. Sometimes people just need a little support to get from point A to point B. They get lost along the way. They don't know how to navigate through systems. Our case management teams help to do that. The participants themselves, they receive treatment services, including medication-assisted treatment. Many of the individuals that we work with right now are have an opioid addiction. And we know this has been devastating for communities across the country, in particular in Philadelphia. MAT, gold standard for treatment, that's something that people are able to receive. They also get individual, group, and recovery support services. Again, robust collaboration with justice partners. And when I mean justice partners in this particular sense, I'm talking about probation and parole. We do Medicaid enrollment prior to release, so that way people have the medical insurance that they need before they go back into the community. And not only pays for their behavioral health services as well as their physical health services. And then we also do referrals to PHMC's network of FQACs to deal with their physical health concerns. In light of COVID, we now use telehealth, okay, for our case management services, behavioral and physical health services. Challenge with that, not every participant has the actual technology, the cell phone, the computer to actually interact in that way. What I'm really pleased to say is that my team has been doing remote behavioral health assessments by way of Zoom behind the walls of the Philadelphia Department of Prisons. I'm not sure if other jurisdictions are doing that, but I really say that we're really trying to meet the needs of our participants in doing this work, and also by phone. We continue, again, collaboration with our partners. One of the things our case management teams really had to do at the very beginning of COVID, where we were the information resource entity network for our participants. Probation was closed, the courts were closed, Defenders Association were closed. We were the source where people were, our participants were coming like, what do I do? What's happening with my court hearing? So we became that, that magnified source of support for the individuals. Our staff have also done COVID-19 education with our participants, because again, that's really important for them taking care of their health status. And then we provide PPE also for our staff as well as for the participants. Again, we've continued to do Medicaid enrollment prior to release, and then referral to PHMC's network of FQHCs. And then I'm just going to end with just a little information about COVID-19 on the national and state and local level. Received this information recently in a meeting last week, just around the number of individuals who tested positive for COVID-19. Nationally, 275,000 individuals. Of that, 1,700 have died. We know prisons are, as Dave said, breeding grounds for COVID-19. This is not where you want to be. In Pennsylvania, according to the Pennsylvania Department of Corrections, there were over 7,300 positive COVID cases among prisoners, and then 73 deaths. And in the Philadelphia Department of Prisons, I don't have data, but I know at one time it was reported that over 200 individuals were positive for COVID-19, and currently PDP has been sheltered in place, I think, for at least going on for 2 months now, and that means that people are pretty much restricted on movement. Think about the toil and the taxing, not just on the physical health if you're impacted by COVID, but also on your mental health status while incarcerated. And I'll end there. There's my contact information as well, and thank you for your time.
Thank you, Laurie, for that presentation. Definitely, attendees, we have some great questions for the panelists. We're going to start so that we can make use of the time. If we don't get to all the questions, please outreach to the panelists on the Mid-Atlantic Conference app that you can utilize. First question a lot of us have is regarding, do you think, panelists, that we need to completely dismantle our justice system and rebuild it to effectively achieve reform, or is there any hope in modifying what currently exists? And anyone can answer.
It's a big question, but I'll take a stab at. I don't have the answer to that, and I am trying to do this type of research or to think about reform with an open mind and sort of see what does take place. But when you look at the history of reform, we see that there has been a lot of success in professionalizing the police and making them more efficient. And as I talked about, when you looked at the history, that often was at the cost of doing some of the other scope of work that lived outside of simply responding to the crime. And the role of abolition and that movement comes from this idea that you can't escape this historical origins, and therefore you're just reordering, or you're not actually addressing the issues that have led to the health inequities what we have right now. I think that what we do need to consider is who is making decisions and the power they have in developing the reform. If it is doing the same model where it comes from within, either directly that it's coming from a police department or the mayor that has elected the leadership, that is unlikely to be that sort of external upheaval of the system to disrupt it enough that we're actually going to get at what the causes are. But the problem is that a lot of the grassroots movements to change and to address the issues that we're still crying out to be changed right now have had little teeth and tend to just be ceremonial or have a limited effect time-wise. I think the third piece that I just want to bring about is exacerbated in this time of the pandemic. We see that the questions of resources are really strapped, and so that the impact is seen both in the services, the social service industry that are already competing for not having enough funding, that if we're asking those professionals to take on more, they may not have the resources. And we're also seeing it in record number of issues of recruitment challenges in Philadelphia and Baltimore and all these police agencies, it is not a time to be a police officer. And part of that is both public opinion, but also the lack of sufficient resources to do effectively what we're asking them to do, even if we limit that scope to just dealing with crime. And so those lead me to think, is there another way to do it outside of this, of the system that we have right now?
Thank you, Abigail, for that response. The next question I'm going to ask David or Laurie to answer, and it relates to, are there any strategies for police reform, such as training, mental health supports, et cetera, that you are particularly optimistic about?
I'll give. I'm not sure I'm optimistic about anything right now. I'm gonna be very honest, because again, we know that there's been things such as crisis intervention training available for police officers outside, like in the Philadelphia community. But even with that, we had a tragic death in our community a few months ago of an individual who had a mental health crisis. There's been talk about systems change, but you know, even as we interface sometimes, our teams interface sometimes with our colleagues in the behavioral health system and other systems. It's to me, it's not really getting to what really needs to be addressed, which we're talking about cultural issues here. We're talking about systemic racism. We're talking about people's views of the world. And so, you know, within, it has to start at the end, like there has to be a willingness for at the individual level people to change. You can, you know, there's things that where systemically you can sort of require people to do things, but at the end of the day, it also has to flow from the individual level. Heard somebody recently talked about there is a training that's being done, I think it's called Police School, where they actually, the police officers have to live the experience, have to be very experiential in their training and really have to identify, this could be my mother, this could be my brother, this could be my family member, in order to understand the impact of what they do. So I don't have a particular model, but I think we're really talking about there has to be a culture change. And that's really, you know, a much broader piece. I think the other thing, you know, and I just want to piggyback on what Abigail said, you know, sometimes we're putting our money in the wrong places. I thought it was amazing how, you know, for many years, we've never been able to get enough food to people who are poor. COVID-19 hit, all of a sudden food boxes started appearing everywhere. All of a sudden money appeared to take care of things that were really important. So let's put our priorities in order. I think we as a country really need to figure out, where do we want to put our money at? Do we want to put it on this continued policing that really that's really damaging our community, or do we need to go in a different direction?
And just to add to that discussion of the broader culture, also the culture of policing, you know, as I said, I was a probation officer and I talked a lot with police officers and I trained them on domestic violence issues. And the ones I trusted the most would come to me and say, you know, we get all of this good training, especially at the beginning of their career, and they go to their department for the first time, they're assigned a field training officer, and that person essentially tells them, forget everything you learned, you're going to learn how to do it here and how we see it here, which always then reincorporates the racism, the sexism, all the social ills that the training has tried to work out of them. I think use of force as a police culture issue is an issue, because we use the tools we have. And when I was a probation officer, we didn't have lethal force as an option in our department. It never had existed for us. That happened after I left. And in the years I was there was one incident, 6 years, there was one instance of an assault on an officer, a probation officer, that was not, it was physical, but it was not permanently injurious to that person. And the worst issues we had to deal with in terms of officer misconduct were probation officers saying unkind things or inappropriate things to probation officers versus physical violence, because we didn't have a use of force model that allowed us to escalate the deadly force. So I think we really need to look at that. But to go back to the first question too, you know, we've talked at DCJ as you know, our job is to reform the system, but we may have to build a new system around it and not necessarily dismantle, but when I say we talk about justice as opportunity, we truly do see it as, if there are opportunities in people's lives, they simply won't wind up in the criminal justice system to begin with.
Definitely. Thank you for that. This next question I'm going to address to Abigail. It's in regards to the 1033 program, I believe, that allows for police to access military equipment. How can public health professionals address this and spread awareness of this policy?
Great, thank you. So yes, this program was established in '97 as part of the National Defense Authorization Act, but the story behind it actually goes back to mid-20th century when there was the backlash of a lot of the civil rights movements. And to suppress that, a lot of cities gave their police the authority to suppress riots and informally purchased a lot of this military equipment, which just sort of upped the ability of use of force, but also really diminished any community relationships that the police officer had with civilians. But the question, I think the question asker was referring to one of the law or the proposed bills that Maryland State is offering, which is to cut that program as something in Maryland police to not allow for military equipment. And I think that it is something that is not common knowledge and not known when we're thinking about police, other than being highlighted in recent protests, where that was the reaction of the police up until last Wednesday, that it upped the ante. It showed that this is not just free speech or issues of individuals' lives, but this was a movement that needed to be responded with extreme violence. But with regard to public health, I think we can couch it in the conversation about violence, which is extremely recognized as a public health issue, and to start talking about it, or even looking into what's happening at your state or the local public police agencies and what rules, and if this is a law that should be modeled and pushed. I don't have the data behind me on how many other localities or states are trying to have reform in this way, but it could be something to look into.
Thank you. Thank you. In addition to that, we have a question regarding how can public health professionals really partner with other disciplines to kind of bring awareness or suits to police departments who are violating the rights and health of others in the community. Any information?
A place to start is your community legal aid services. They may be looking, if they have the resources, to create a class action lawsuit, but also your ACLU affiliates in your states is a place to start for that kind of work.
Awesome. Awesome. Thank you for that. Very important information to know. And last but not least, let's talk about your thoughts on the importance of addressing trauma many of our residents and communities have experienced as a result of police brutality and mass incarceration, and the importance of this as we move towards criminal justice reform. Any closing thoughts?
I'm the one person on the panel who's not on the ground doing this work, but I know that there are models of trauma-informed care that have been rolled out in education and housing that can potentially be rolled out as part of the training that law enforcement need to experience. But the dilemma, as Laurie and Dave mentioned, is the difference between what policies exist and what training exists and what happens in practice. And so there needs to be some recognition and actual action that commits to the relationship police have with people on the ground. And I think that there, in the 1990s, there was an effort of community-oriented policing, but it was in most cases just an office that had some community-oriented police members, and it has to be a full commitment of the agency to actually and how they're doing the work. And I think that will better address the trauma than any specific type of training that it becomes a box to be checked.
Thank you, David. Laurie, any closing remarks regarding trauma for our residents in our communities?
I mean, trauma impacts everyone. So it's both the individual living in the community, but I think the other side of it is also the police officers, the trauma that they're experiencing. And that goes back to what Abigail talked about earlier, is about, you know, the difficulties now police departments are having recruiting into classes. Things, you know, I, in a meeting recently, heard about within 3 years, how literally the brain function of police officers change over time because of all they experience and all that they see. So again, I think this becomes a larger issue from the public health perspective of how are we taking care of, it's really how are we taking care of people that we're charging to interact with and or work with other individuals. We talk about it a lot. I'm a social worker by training as well. We talk a lot about it in the behavioral health space or the social service space and how do we take care of our teams. But again, we're also talking about police officers who are interacting with human beings. And I think anytime you're interacting with human beings, trauma and sort of your history and what's happened before will be, you know, playing out in the work. So it's more than just the trauma training. It really, again, goes back to not only people understanding, I think, is the development of relationships. There is, you know, you have to, and I'm gonna keep going back to this. Everybody has, there has to be a step back where people have to look at themselves and their relationships to others. Because if you can't do that, then you're really not going to be able to do any of the work, whether the public health work that we do, whether the policing, definitely there needs to be changes there. The trauma is not going to go away. There may be people who are familiar with the ACEs study that has done, you know, just in terms about the pervasiveness of trauma in our society. So again, you know, this is a societal problem. You can't sort of pull the things, you can't pull them apart. And we really should have to really look at this in a very holistic way. But I think what happens is we want to look at these individual pieces instead of how things intersect.
Thank you. David, real quick.
Yeah, I think it goes back to what we've talked about the allocation of resources. I think police are also traumatized by the fact that they are asked to be social workers. They only, and again, with the toolbox that they have to do their job, they are likely to contribute to a traumatic situation instead of help to alleviate that trauma by being able to hand it off to another professional. So I think that really starts answering the question of trauma in the system.
Thank you. Thank you so much. I just want to say again, thank you to the panelists. This was a very informative presentation, a lot of great topics, and a dialogue that we're continuing to have. Great feedback in the chat from the attendees. Some questions we were unable to get to. Please, attendees, you can still utilize the conference app for your questions. And I just want to say thank you again for the work that you do in the community as we work to make difference in policies, legislation, and on the streets with the justice reform for our participants. And at this time, I just want to end the session and say, please enjoy the rest of the conference. Thank you so much.
Thank you.